Bob and Brad, the two most famous physical therapists on the internet.
Hi, folks. I'm Brad Heineck, physical therapist.
Hey, I'm Chris the Pharmacist.
And I'm exactly one half of the Bob and Brad Physical Therapy channel. But today we're going to go off into the pharmaceutical world slightly with ibuprofen. We are extremely happy to have Chris, our usual guest for pharmacy expert advice. And he's been, well, you've been doing this for how many years, Chris?
A few.
Yeah.
26.
26 years. He really understands the topic extremely well. He's going to give us up-to-date information. If you want to know, should you be taking it, how much to take, and are there any side effects or precautions when taking it? Everything will be answered by this young man. And I'm going to quit talking because I babble on. They're already saying so already.
All right. Well, sounds good. Well, yep, we're going to talk about ibuprofen today, guys.
It's your cord, Chris. It's getting
my goodness.
I'm
losing style points already. So my apologies, dorky pharmacist. But nonetheless, ibuprofen is actually one of my most favorite pain relievers because it's so versatile. I mean, it does a lot of different things for the human body. It helps with pain and inflammation, it's in the NSAID category, non-steroidal anti-inflammatory drug. So basically aspirin is the granddaddy of them all, but ibuprofen, I would say, has a lot more utility than aspirin in so many different ways, only because it's a little bit safer. So we'll kind of talk about some of those as we kind of walk down some of the side effects and stuff when we get there. But
so I always think of ibuprofen as primarily an anti-inflammatory. In other words, if you have swelling, you want to reduce the swelling, reduce the pain as a result of that swelling.
Yes.
That's kind of what it does.
Yep. But it also is a great fever reducer. They call it an antipyretic. And so let's say you've got a fever or your little one has a fever. It's great fever reducer. And it's,
oh, really?
So yeah, I mean, it kind of competes with acetaminophen or Tylenol for that respect. And so if you're ever sick and feeling under the weather, and right now we're dealing with COVID and all those different strains. I mean, or influenza. We're in flu season, cold, flu season up here in the Northern Hemisphere. So honestly, when you are achy and feverish, it's an excellent drug. I think it actually has got a little bit more utility than even, say, acetaminophen, because Tylenol or acetaminophen or paracetamol, for the people that are listen to us across the pond, only works on fever and pain relief, whereas this adds the added dimension of anti-inflammatory to that. And when you're sick, there's a lot of different things going on with our body. And so that anti-inflammatory aspect of the ibuprofen, I think, is very beneficial when we're sick and achy.
Okay, so let's say, for example, if I've got a cold, sniffly, I've got aches and pains, like fluish symptoms, or I sprained my ankle and I got swelling, all of those ibuprofen would be appropriate to take.
Covers them all.
But then how much? Or how much not to take?
Yeah, so basically for an average human adult or anybody over the age of 12, so basically we would consider 1 or 2 tablets, and each tablet contains 200 milligrams.
That's a standard,
That's
isn't it?
a standard tablet. So they make a junior strength for kids. It's a chewable. It's 100 milligram strength. And then they also make a liquid that comes as 100 milligrams per 5 milliliters. So it can be dosed down to kids as or teaspoon.
But that's typically for kids?
Yeah, that would be for kids or maybe adults that have swallowing difficulties.
I see.
So, I mean, there's a variety of different ways that you can obtain ibuprofen, but they all work the same. I mean, that's the bottom line. It's a really versatile thing to have in the medicine cabinet, but if you're allergic to aspirin or any component of ibuprofen or ibuprofen themselves or other NSAIDs, you want to avoid it, because obviously an allergy would be something that we have to be very, very careful with.
So I want to go over this a little more detail, because every time I look to figure out how much these I should take, I just text you anyway if I can't remember. But is it the body weight or the age that determines?
You know, in general, the way the FDA has kind of settled these things in would be basically by age range, but it's more specific and more appropriate by weight, and particularly with juvenile patients or pediatric patients, we're going to do a milligram per kilogram dose specifically to make sure that it's on their body weight. So
you're talking about 5-year-old, 10-year-old?
Yeah. So let's say you would calculate out, it's, the usual calculation we would use is 10 milligrams per kilogram per dose.
So we're talking kilograms. Can we get the pounds?
Well,
if you got a 50 pound child.
You got a 50. So you got to multiply it by 2.52. And so basically you just do the math and you just,
I bet you can Google this.
You can Google this, but
I mean, it'll tell you.
Even easier, just ask your local pharmacist or your doctor what's appropriate. I mean, What we would tell you in an over-the-counter setting is to use the package instructions based on either body weight or age.
Okay.
So for most, people 12 on up, I digress. It'd be 1 or 2 tablets every 4 to 6 hours apart
Okay.
as needed,
Yep.
to a maximum of 8 tablets a day. So that, said 200 tablets per tab, so it's going to be 3,200 milligrams
Yeah.
as a maximum daily dose.
So 2 tablets,
Yeah.
4 times per
Yeah.
day.
Yeah.
Yep.
But prescription is 3,200 milligrams would be the absolute max, but it's available as a prescription too as 400, 600, and 800 milligram tablets by doctor's orders only.
Sure.
So, but 3,200 is the absolute max, but that would be again by a doctor's order.
Right. So if you're taking these over the counter, you're sick, and like I weigh, 175, 180 pounds, depending on the time of year.
Yep.
I'm going to take, and I take up to 4 of these at a time, and that's probably max, or maybe I'm overdoing it.
Yeah, it's probably overdue. I mean, you want to be careful with that. Talk it over with your doctor, because again, one of the side effects that we'll kind of devolve into with this discussion are with the blood pressure issues and heart issues
Okay.
or stomach issues. But so 800 milligrams is aggressive. It's not uncommon, but you'd want to make sure your physician is happy with you using that dose,
Right.
because it could cause damage to your stomach. Stomach ulceration is certainly a big consideration.
And if someone doesn't have a physician, or it's too much of a problem to be safe, 3 is
probably 2 tablets every
2?
4 to 6 hours apart.
Okay.
Yeah,
2.
you would just stick with the standard over the counter, because that would be the straight legalese from that standpoint.
Yep.
You're not going to overdo it. When you go to the prescription side, so let's say you're being treated for osteoarthritis or arthritis, you will have doctors writing prescriptions in the 600 or 800 milligram range.
That's
Because
per tablet.
per tablet.
Yep.
And that dosing level will be more effective, especially when you're looking at something as uncomfortable as osteoarthritis, that wear and tear that we all kind of experience.
So the average person is going to take 2
Two-
of these 4 times per day, maximum.
Yeah, and we really wouldn't want you using it for an extended period of time. We use that 7 as kind of the cutoff. So if you feel that let you sprained an ankle, strained a back, fever, I mean all these things. So kind of 7 days is kind of your line in the sand. You'd want to be talking to your doctor if you're not getting any serious relief, or if you're experiencing negative side effects.
Okay.
So we want to be real careful with that.
So that many, two of them 4 times a day for 7 days. If it's not showing obvious signs, it's not doing anything.
You should be talking to your physician.
Sure.
So or at least pop into your local pharmacist, which is probably going to tell you to turn around and talk to your doctor, or find a provider, or run into urgent care if things are not better.
All right.
But one of the things we have to kind of look at, with ibuprofen use is side effects. So what can be a negative aspect of using this either too, and sometimes side effects can occur very quickly, or it may take time if you're using it overly often. So you want to be careful with that. So stomach ulceration is the first thing that comes to mind. So basically the way that these drugs work is they inhibit prostaglandins, which are the kind of the thing that helps to maintain that mucus lining of your stomach.
Sure.
So, and ibuprofen helps to slow down the process of how prostaglandins are made. That's why it's an anti-inflammatory when you look at this.
Okay.
So not to get overly technical, but so repeated use in most cases, but sometimes even short-term use, it can cause bleeding ulcers or gastritis or just a lot of irritation to the gut. So we like people always to take it with food, or at least a glass of milk, to protect their stomach.
Okay.
So to make sure that doesn't happen, it just slows down the absorption. It's not so much that it doesn't burn a hole in your stomach, which is kind of a
Before you eat,
misconception.
after you eat.
Eat first, then take the
Okay.
medication.
Okay.
That's most ideal. If you take it on an empty stomach, it absorbs pretty quickly, and which is good. But the problem is it could cause damage to your stomach lining. So you want to be mindful with that.
Now, I've heard there's issues with, is it your liver or your kidneys that
It's primarily metabolized in the liver, but oftentimes it's really difficult to have liver failure from using NSAIDs like ibuprofen, but it's still problematic. And if you were hepatically compromised, dosage adjustment would be definitely priority number 1, which your physician would let you know what you could safely get away with.
So if you have liver problems,
liver failure,
you've got to be careful with this.
Exactly.
Talk to your doctor.
But more importantly are the kidneys.
Okay.
So it's just basically the way that NSAIDs work and how prostaglandins work and how they affect blood pressure. And it gets kind of complex and kind of techy. But the reality of it is we have to be real careful with how we use this. If you're somebody that has renal failure, it's probably something that should not be utilized, because not only can it shut down those kidneys, but it can also be very dangerous for your heart from that regard.
What if you're on blood pressure medication?
Well, and that's, yeah, and I'll touch on that because a lot of those blood pressure medications like ACE inhibitors, ARBs, and diuretics all kind of work on some areas of the kidney.
Sure.
And so that can actually complicate things for the body when they're trying to metabolize those types of medications. So it's important to check with your doctor, your pharmacist to make sure it's safe or appropriate to use. And in most cases, short term use, it's probably okay.
Hmm.
There are other drugs that can be problematic, blood thinners like warfarin specifically, or some of the newer anticoagulants, the DOACs, like Eliquis and Xarelto, which are prescription drugs. But if they're anticoagulants or things that help stop clotting, when you take drugs like ibuprofen, because it is related to
Hmm.
aspirin, it can thin the blood a little bit. And so that could read your risk for stroking out on the bleeding risk.
So yeah, people that are taking these blood thinners, if you will,
Yep,
are typically maybe have a history or a possibility of a stroke, or
correct.
they have some cardiac, some heart
Yeah,
problems.
there could be a lot of different reasons. I mean, if you're on a blood thinner, you had a clotting issue.
Okay.
And so and what happens is when we add a drug like aspirin or ibuprofen, it swings the scale the other way. So you were clotting too much.
Yep.
Well, now we're taking these drugs to help to minimize that clotting
Yeah.
process.
Hmm.
And so now we add ibuprofen on top of that,
Yeah.
and that can make you bleed. The risk raises
So
for
if you
bleeding
cut
more.
yourself,
You're
it
going to
may
bleed
keep
more. Yeah,
continue to
bleed or
bleed more
bruise.
than you'd like.
Conceivably, and that's why
Sure.
you do not want to use ibuprofen with any
Sure.
anticoagulant type of
Yeah.
therapy. So it's very important to be in touch with your doctor and pharmacist. Always check because even though it's an over-the-counter product that is readily available either online or in the grocery store or the
Hmm.
gas station, you can get it anywhere. You do have to treat it with respect because it could cause some negative
Sure.
problems.
Yep. All right. Excellent job, Chris. This is always a good review for me. We've done this before,
Sure.
but I think there's a lot of people who, aren't aware of these things, and now they can feel comfortable with their knowledge.
Absolutely. Yeah.
So
Safe stuff. Good stuff. Just be careful when you're using it. And if there's ever a question, talk to your doctor, your pharmacist. We'll be happy to help you out any way we can.
that's right. And be careful as always.
All right. Thanks, guys.